And we're going to publish this on YouTube. Just kind of have an ongoing series of these health talks. I think it'd be interesting to kind of see the progression of how it goes. And people can follow up. People that couldn't make it today can follow up and listen in on our mission and what we're trying to accomplish. I was going to try to broadcast this live over Facebook Live. It's a kind of interaction with Zoom. Couldn't quite get that working yet, so I just postponed that for the next time. I think it'll be all right.
Cool.
Sounds great.
Hey, Monica.
Hello.
Hey, how are you?
Good. How are you?
Doing wonderful today. Let me see here. I heard somebody talking about a storm up in the Northeast. Must be Grace.
Yes.
Are you under some snow right now?
Oh, well, I'm in Philadelphia right now for Patients as Partners conference. So there's no snow here. There's flowers planted in front of the hotel. Back home, we have 2.5 feet of snow. Power outages, thousands of trees snapped in half because the snow is so heavy. It's really a messy cleanup. We were fortunate to have power, but now there's more snow coming. So, I'm counting the days to Memorial Day weekend where it's the official summer here in New Jersey.
Yeah, I don't want to talk about our days down here in the South.
Already have, sorry.
Yeah.
We're having a really unseasonably warm day here too, but I won't tell you it's 60 degrees.
Oh. That sounds rough.
I know. Usually, we were freezing a week ago and snowing, so this is just really, really lucky.
So where are you? What part of the country are you in, Becky?
I'm in Washington State. I'm right in the middle of the state.
Okay.
We get sun here instead of rain like Seattle.
I think I like where you live better than Seattle then.
Yeah, I think I do too. I moved away from there.
You weren't having it, Megan, huh?
Huh?
I said you really weren't having it. You went straight down to Arizona for pure sunshine.
Oh, yeah. We have a overabundance. It's funny because though January and February it was kind of overcast and
oh no.
Yeah, it was. But now I understand seasonal affective a little bit because it was for weeks and that's not really typical. And then February warmed up just a little bit and then it got like super cold. So the past couple weeks have been really chilly. I guess really chilly is like in the 50s. But considering it can be, 50 plus degrees warmer or even 70 plus degrees warmer. So yeah, it's interesting. So while I'm looking forward to Memorial Day, that's about the time when we're starting to hit those 100 degrees. And as long as it stays about 105, that's okay. But when you get into 117, you could get like a stretch. That's kind of scary. So, But
I had that big heat wave come through last year. I saw pictures of people cracking eggs on the sidewalk and frying them up just like that.
They get people take cookies in their car. Yeah. So they'll take the cookies and they'll put it on their dashboard, and literally by the time they come out by the end of the day, they'll have baked chocolate chip cookies.
That's actually a perk of living there, huh?
Make lemonade out of it, right?
That's what you do. So, yeah.
Hey, let me see. Linda asked if she could join it via Twitter. I don't know if you saw that notification.
Oh.
What does she mean by that? Twitter.
Quick shout out to my partner. Hi, Becky.
Hi, Lise. I'm waving at you. You can't see it, but I'm waving.
Thank you.
I'm glad I got home in time.
So who else do we have here? I see another phone number down there.
This is Heidi Grabenstatter. I'm just on the phone.
Hi, Heidi.
Hi, Heidi.
Hi. I'm calling from Colorado. I was just interested in learning more about citizen health. I'm sorry I didn't join on the computer. It was going to be kind of a bad scene with the kids running around, I think.
All right. I just renamed you there, Heidi, so everybody knows that phone number now. So we got 9 people expecting, and we actually had 15 registered now. I think 2 more people just registered. Probably start trying to figure out how to join Zoom, probably downloading it now. We got Nabil. Hey, Nabil. Let's see. So let's give it about another 4 minutes. We'll give it about 10 minutes for these couple other people to join. Now, I know Grace and Lisa, y'all have some topics you want to discuss. You want to just kind of maybe line out the topics of kind of the flow of everything?
Sure, absolutely. So I guess what we start with is what the importance of including patients and care partner perspectives when you're making any kind of a move with respect to innovation or an improvement or something that's going to be disruptive in the healthcare environment. It's really important that we aren't basing solutions on assumptions, but rather really getting an understanding and incorporating empathy into the research that's being done to really drive something that embraces what people value, what their preferences are, what their needs are. So we're not backpedaling and trying to fix shortcomings later on. I'm really thrilled to be here and have this opportunity to collaborate with you and Citizen Health and with Lisa, and looking forward to sharing some insights from my area of expertise. So I'm a private cancer patient advocate. I work with patients and their care partners from point of diagnosis through survivorship or end-of-life care planning. And I assist people working with them daily to navigate their diagnosis or the healthcare system, which is a disaster. And there isn't a single patient or care partner, in my opinion, that wouldn't benefit from having an advocate because it's really challenging. And based on these experiential learnings, and I really see the need to improve the patient experience. So I've also moved into that space because there's definitely so many opportunities, from seeing the grief, seeing the lack of access, the barriers, the unmet needs. From my perspective, there's so many ways that we can improve the patient experience that I'm hopeful, and I look forward to collaborating with people who share that passion.
Okay. Yeah, Grace, can you give me a little background on your company and what you guys do? I was kind of reading into it earlier. I was just curious to hear it from your point of view.
Sure. So I founded Enlightening Results, and I do patient advocacy professionally. I have committed to doing this as a full-time position, and I do this as a paid position. And I also do a lot of outreach in community because not everyone can afford to pay out of pocket for an advocate. Insurance companies do not cover my cost. And what I do, it can vary. It could be an a la carte service. For example, someone might say, you know what, I received a cancer diagnosis. I have no idea what to do. I have no support system. Could you point me in the right direction? What's a good hospital to go to for colorectal cancer care? Or can you help me find a clinical trial? Or I had a relapse, and I'm having side effects to my medications. Can you point me in the right direction? So what I do is I try to do a medical translation and be a liaison and see what challenges people have at the moment. And these challenges can be dynamic over time, and they evolve. And I try to bring peace of mind to those challenges, bring the information so that people can make an informed, empowered decision regarding their care, as opposed to reacting and making a decision based out of fear.
So what's the main, I guess, client base, patient base that you work with?
Sure. I would say middle age, I would say 50 to 60 years old. And often I see a person that has advanced cancer or a relapse. Perhaps they were diagnosed and they took a stab at it themselves, and it got very complicated very quickly, or they don't have the support system, or they have a full-time job and they just simply cannot sit on the phone for hours with an insurance company or call multiple places to get medical records records or waiting for the physician to call them back, or or they just don't understand the whole process. Maybe they're in finance and they don't have the health literacy to understand what's going on. So I try to understand what the shortcomings are and bridge those silos and gaps.
Okay, nice. And you're actually helping people. That's what I like about it. Like, the end result is somebody gets help, and we need more of that. We need more of you.
Absolutely.
Well, let me see here. It is now 6:10. I guess I'll go ahead and start if we haven't started already. But I'll just kind of give a brief overview, just a general overview of what citizen health is, and then I'm going to turn it over to Megan, and she can kind of give an overview of what these health talks are going to be moving forward, and then Grace and Lisa, y'all can take it from there. So what citizen health is, it's a grassroots movement of people like us who are fed up with how healthcare operates in this country and who want to come together and join forces to build something better, something that works for us and works for our families. And the model that we're building citizen health on, it puts the patients and the caregivers and the health providers at the center of it, and we're designing around that versus the opposite way the status quo is now, where the patients and the health providers are afterthought after the money's made. So we're kind of redesigning the whole entire operation. And this is made possible by this new technology called blockchain. I'm not going to get into the technical side of that. Too many people get hung up on what it is, how it works. But at the same time, if you look at the internet, not too many people know how the internet works. You just know what it enables. And that's one thing we're looking at is, what does this new technology enable? What business models are possible from these opportunities? And we take those and have a forward-looking approach to the future and start planning for that. So the one thing, I say the one thing, probably one of the most important things that blockchain technology enables is the removal of intermediaries from a lot of systems. And in our system, yeah. And when you remove intermediaries, you got to think about the dollar that comes from our pockets, our bank accounts, and goes to the doctor. There are numerous people, intermediaries in the middle, that just takes a piece for their cut, and it gets to the doctor, and there's not much left over from that. Well, with smart contracts and distributed computing and blockchain technology, it really allows a direct payment between the patient and the provider, and moves a lot of the intermediaries, moves insurance companies. As you go on down the list, a lot of people are going to be out of jobs and industries are going to be disrupted. But look at Blockbuster, look at newspapers. It's just inevitable. But what this enables is an opportunity to scale out a direct primary care network. I'm sure everybody knows how these direct patient-to-provider contracts work. Well, you can imagine that at a nationwide or global scale, where everybody is paying the doctor directly, but at the same time, everybody is connected. So that's kind of the high-level overview, and there's a lot of steps to get to that. There's a lot of things we're doing, starting from the base in terms of quantifying health, giving everybody a health score that they can improve based on certain metrics, going walking, getting proper sleep, taking flights of stairs, and so forth. So we're kind of starting off with gamifying healthcare at its core and making it fun for people to go out there and be healthy. We have cryptocurrency in our system. We have a couple of different tokens. I wasn't planning on getting too in depth with this, but we have ways to operate this economy that we're creating with our own cryptocurrency. So we can leave that for another time, but at a general overview, you got the idea. Does anybody have any questions before we get started? If not, I'll turn it over to Megan, and you can take it from here.
Okay. Well, welcome everybody. My name is Megan Janis, and I am the digital health strategist for Citizen Health. I've known Brennan now for probably about 9 months or so. He wandered into some Twitter chats, some healthcare Twitter chats, and we just started talking and just all about Citizen Health and everything that he just explained. And I love the concept, and I love what Citizen Health is aiming to do. So as we've started to develop some of our systems and our processes, we decided we've got to get the community involved. And the earlier we do that, the better off we're all going to be. Healthcare isn't going to wait. Patients aren't going to wait. So here we are. And so we started off with an ambassador program that kicked off last month, and some of you are here with us, and we're so excited. And now we want to take those conversations further. So we've got these online talks. You can connect with us out on Twitter at Citizen Health IO, and we are here to just do all things better with healthcare. So the Citizen Health Talks, of course, they're going to revolve around different topics. The first one, of course, patient advocacy, and that's why Grace and Lisa are here today. Grace told us a lot about what she does, and now to Lisa too. Please tell us too more about what you do and your involvement with the CP Nerve Center. Of course, Grace has enlightening results, and Lisa, along with our partner Becky, they've got the CP Nerve Center. So that's a lot of what we're going to be doing. We'll be featuring different people and their areas of expertise. It will revolve around all different kinds of things related to healthcare. And the thing that we want to do differently with these talks is to not only bring people together, but then propose the solutions and what we can do to further take what we are doing, what everybody else is doing, network that together, and then further take it out into the community. So it's not just a talk, there is action and actionable things that we can do as we scale and grow. So I want to make sure that everybody understands that too. That's part of what we're doing. It's not just, hey, let's just be here and learn. Let's go act. And I love that, because I think that's going to set us apart and distinguish us in citizen health and what we are looking to do in order to help people in healthcare. So that being said, Grace, thank you so much for your introduction. Now, Lisa, or if you could please give us a little bit more about what you do, and then we'll kind of get started. One more thing down at the bottom, if you'd like to, say something, have a question, you can either jump right in, but you can also raise your hand if you'd like in the participants. Next to your name, I think it is. You could get down at the bottom there. So if you click on your screen, if you're with us via video, you can raise your hand and we can kind of watch that. So if you have a question, or don't be shy, just jump right in. We're really excited. So Lisa, go ahead.
Thank you, Megan. Hi, everyone. I'm Lisa Davis-Budzinski on Twitter, if you see my name. I am a central pain syndrome patient advocate, and what that means is I got my central pain syndrome from a stroke to the thalamus. My partner, Becky, got central pain virally through having the shingles, and we noticed there weren't many resources out on the internet for awareness for central pain syndrome and how someone can get it. And unfortunately, you can go along in life in your career, and just one day it's all going to change. And one day everyone's going to become a patient. You just don't know how that's going to happen. And I applaud Citizen Health for wanting to keep people healthy, because I think that's wonderful. If you know ahead of time, you can prevent things. And that's why Becky and I at the Central Pain Nerve Center are really interested in Citizen Health, because it's like Grace said, we agree with her. It's just awful to go through the healthcare system. There's just so many things to contact, people to contact, and you're feeling your worst when you're talking to these people. Bless Grace for being an advocate for those that can't talk at the time, because it's really, really difficult. But if you add in the intermediaries like health insurance, that just gums up the whole works. And I'm so excited with Citizen Health, thinking that they can take health agencies out of it, healthcare agencies, because that would be wonderful if we could all collaborate and give our resources and 30 years of experience of how all of this is just a big quagmire. I think it'd be wonderful, don't you?
Absolutely.
Yes, me too.
Any questions?
No? Okay. So yeah, thank you so much, Lisa. And yeah, that's why we're all here. We're here to do things differently, and we're here to understand the role of patients, and we're here to understand their needs. And I think that's a big thing that we're going to explore today, is basically breaking down some of the technology, but then also interjecting into that patient side, so we can absolutely understand what we need to do and how we can be more aware, and that awareness and the knowledge is critical for our mission. So that being said, Grace, why don't you go ahead and tell us what patient advocacy means to you, and how we can start to blend that into with technology.
Sure. I think patient advocacy, from my perspective, is really enhancing the regular real person's voice. These people might not be tech savvy. They might not have the health literacy or the health experience literacy to navigate and bring a light to their particular situation. But that's not to say that these experiences are not valuable, and these insights don't carry a lot of weight and should be addressed. So as a patient advocate, I hope to bridge that gap. So I'm big into technology and mobile health, digital health tools that can be used to augment and enhance the patient experience. But many patients don't know about that stuff, and it's overwhelming, and it's not part of the regular conversations in their day-to-day world, especially when you have a chronic illness. It's almost another foreign, in addition to the foreign language of the healthcare system. So what I'm hoping is, I would like City Health, this collaboration, to bring simple awareness and education to the amazing technologies, the platforms that are out there. We always hear as patients that it's pretty bleak out there, but there's amazing people doing wonderful things that are trying to advance healthcare, and it's coming from the bottom up. Can't wait for solutions from the top down. At least I want to wait, and I'm excited to have connected with you guys who are eager to chip away from the bottom to make a dent here. I have been fascinated with blockchain, and a lot of people say, blockchain isn't a solution, it's a tool. But the potential of the tool, from my perspective, is so profound. A big thing that I encounter, and I'm sure Lisa and Becky, is data access and patient ownership of data. It's like the age-old great debate, and anyone that is living with a diagnosis, you just can't get your records when you need them. And it's such a struggle and such a fight, and the fax machines and the calls and the papers and the mailing and going in person to get to that next critical step. People are literally dying waiting for medical records and appointments and procedures, and physicians are hampered too. The electronic health record system was not designed with the patient in mind. I'm always fascinated by how seamlessly a bill flows through the system. Has anyone ever gone to an appointment, an exam, and not gotten a bill? No.
Exactly.
But if there was interoperability designed with empathy, the procedure results or the lab work would come first and then the bill. And with blockchain, there could be this amazing technology that gives the patient data ownership in theory, allows for collaboration, allows for integrity, allows for accuracy, interoperability, and a very accurate, precise timeline of events. And it would be comprehensive. And that's something that the regular person doesn't know about. And I'm just in the early stages of learning how this all could manifest. I'm eager to with you guys to learn from you, from the technology, how we can partner.
Agreed.
Yeah.
It's true. There is so much that this technology can do, just beyond the payment mechanism. And I think that's another big key to is understanding exactly how many different ways this technology could be deployed across the healthcare system to make a difference in not just in payments, but then of course in records, in identification. And then of course, there's that whole other debate too of how to make sure that, that interoperability does become, true to form. Because if not, we're just going to build something still in a silo. And, we can't build any more silos. So as long as we have people at the table that are going, okay, let's stay true to the meaning of this blockchain technology, make it central to, actually being owned by people, and then I think we're going to make some headway. But if somebody's just like, oh, I'm just going to use this one blockchain technology right here, we're going to have a big problem. So I think that's part of where we've got to go with this, and I think that's why educating and education is a big deal.
I want to add something there. It's an analogy I've been using. Grace, you're talking about your health records, and basically everything kind of a progression of your health over time. If you go to any car dealership or you go to any place and you try to get a credit card, they're going to pull your credit score. And if you look at your credit score, you see every single thing that's happened to you since you started buying stuff. And
so true.
Anywhere in the country, and you apply for credit somewhere, and they're going to look at this longitudinal data record of you. But if you go to a hospital that doesn't have the same EMR, then they have no clue what happened at other hospital 2 months ago.
Like you didn't even exist.
Right.
Yeah. Exactly.
So if you kind of look at what the promise of this technology can do for a personal health record, you can eventually have all your data on this record. Every doctor can access it with your permission, and you will just have a comprehensive view of your life, of your health journey through all these different surgeries, all these different procedures you had done, a lot of medication that you may have taken that you had adverse reactions to. All this stuff can play a part in an accurate diagnosis from your point in time where you're at right now. So there's a lot of benefits to this, and with this technology, we're early. I equate it to dial-up, where the dial-up internet was. We got quite a few more years to get to where it's going to be mainstream. But it's happening, and I think it's going to happen faster than we think, because there's just so many smart people working on this now. They see it. You got smart people coming from Silicon Valley and coming from your big tech companies are jumping ship and starting.
Academia too.
They see it happening. So
they're building longitudinal for genetic.
Right.
Genetic rare diseases, longitudinal histories for those patients to try to understand the symptoms that they develop, because they don't quite understand the disease yet, so that they can piece apart the disease as the children grow up.
So yeah, I love that. And that's one part that we're looking at is the cost to sequence a genome. 10 years ago, it was $100 million. It wasn't feasible for people to do that. Well, now it's under $1,000, probably around $700. Here in the next few years, it's going to be $10, $20. So every single baby, every child that's born will have their full genome sequenced, not just phenotype, their full genome sequenced. And every single medication that's prescribed to this child through their life will be referenced to their genome to know if there's any adverse reactions, whether that medication is even going to work. Because right now it's estimated that 50% of the drugs prescribed don't even work. And at best, they have adverse reactions. So you start tying in all this don't say exponential technology, because you got AI that's looking at all this data we have. And you look at it's almost the inverse proportion to Moore's law, which is for every year. And we get to this point where we can analyze so much of our bodies that we now can start doing more and more with that we previously it wasn't possible. So the next 3 or 4 years, you have these technologies that are about to converge to really create an opportunity that humanity's never seen before. And that's really what I'm excited about with all this new stuff coming together and finally starting to utilize some of the stuff that a lot of smarter people have been working on for the past 20 years. So it's really going to be game changing. And the thing is, we're looking at citizen health as a decades long project. I mean, this is something that will benefit us, will benefit our children, the next generations, because you look at our current healthcare system, and over the past decade, I've been watching like a hawk, and all the changes are made based on politicians' decisions. Who funds the politicians' campaign? That's where the decisions get made.
Exactly.
So, look, 2 to 4 years down the line, this insurance company wants to do this, so they fund them a little bit. They pass these laws. I mean, everybody knows how it works, but nobody tries to fix it because they wait for somebody else to fix it. And that's what I've been hearing for a while is somebody needs to do this, somebody needs to do that. Well, I want Citizen Health to be that entity, be that organization that does it. That just says, we're not waiting for somebody else to do it. We're going to take it upon ourselves and actually make it happen. And it's going to have to happen from ourselves. Like, we're going to have to do it. It's going to have to be a grassroots movement from the bottom, the actual patients, the caregivers, and the health providers that make up healthcare. And I'll give a brief kind of statistics overview here. But if you look at the actual cost of healthcare, like the amount of money that the American people, we put into the system, it's about $2.6 trillion. You got about $1.2 trillion in premiums, and you got copays, out-of-pocket deductibles, and then you have the taxes withheld out of our paychecks from Medicaid and Medicare. That's about $2.6 trillion. Well, if you look at what the cash price would be, or cash price, credit card price, just a direct price under a direct care model for every single procedure performed, everything, man, woman, child, from birth to death, it's around $900 billion, rounded up to trillion. So we spend $2.6 trillion, and it only costs $1 trillion. It's like, where's that extra money go? Well, it goes to those thousands and thousands of intermediaries out there just taking their little 1%, 2%, 9% cut. Well, it convolutes the whole process. So the idea is, we as a society, as a country, we already pay enough, twice as much as what it costs to perform these procedures. We're just not using our money effectively. And Grace, you said that blockchain is a tool, and yes, it is a tool, and money is also a tool. And we're just not using it effectively. It's like, I think I made the analogy one time, it's like trying to beat a nail with the opposite side of a hammer. It's just not working out. And with this technology and using something as a streamlined process such as cryptocurrencies, where doctors can get paid immediately before the patient walks out the door, it changes. It's a new paradigm. It eliminates the value extraction, and really just it creates a whole new system that gives the power back to us, the people. And I know I made the idea that we are the largest single payer system, like the American people. If we join forces together, we are the largest single payer, hands down. And you look at all the publicly traded health insurance companies, all your publicly traded, any health related company, they're owned by hedge funds and mutual funds, and your 401ks, your retirement plans. And well, whose money is that? It's the American people. So we already fund the whole entire operation, and we just allow the powers to be to do their thing and kind of leave us out, when now we have this technology that we can kind of take that power back and build something that we all want and something that we all need. I'm sorry.
No,
I
feel really, I couldn't agree with you more, Brennan. I feel really strongly too that in addition to making sure the patient and care partner's perspective is there, we have to take care of the caregivers, the doctors, the nurses, the people who are taking care of the patients are often not included in these conversations. The ones that actually provide the care are often not. They're excluded and their voices aren't heard.
Exactly.
Administrators that are there, and the doctors can't manage, and it's not sustainable. And this isn't why they got into medicine. There's a public health crisis with physician burnout and physician suicide, and the need for better tools and for technology to remove the administrative burden as opposed to adding more burden to their day. I think the statistic is that doctors on average, after hours, what they're calling pajama time, are spending two plus hours each night on electronic health records. It's awful. And they're getting paid less and less, and the payments are coming in later and later. It's just not sustainable. And how can we move forward? So I admire Citizen Health for, something simple as making sure the doctor gets paid. It's a no-brainer. Mm-hmm. Why do we have all of these additional steps? Care was delivered, the payment needs to be made, and we move on. It doesn't need to be dragged out 60 days, 90 days, 120 days. It's just not sustainable.
Right.
Well, not to mention the fact that pre-authorizations are becoming more and more of a nightmare.
Yeah.
It's ridiculous. And Grace, on top of the 2 hours after work, they're typically spending close to 50% of their time being glorified data entry clerks.
Right. Right.
And if we can just look at those numbers, we have about 900,000 active physicians. Now, this is just physicians. You got 3.5 million nurses.
Right.
Just look at that time. Okay, let's just do the math. Let's just at a low end, let's just say 2 hours a day is spent on unneeded, non-value added tasks such as data entry. That's 1.8 million hours a day. That's wasted, effectively gone. And how many patients could be seen from those 1.8 million hours?
Mm-hmm.
A 15-minute. If every doctor could fit in an extra 15-minute telemedicine visit, I mean, we don't have a shortage of doctors. We just are not using our doctors effectively. And having insurance as that intermediary dictating all this stuff has to happen with the regulation, with the EMR. I mean, you look at what an EMR is built for. It's not built as a tool to maximize the physician's time and to help the patient. It's built as a billing tool, first and foremost.
Mm-hmm.
What I love about direct primary care is these doctors, they're ditching insurance, so now they can use new systems that act as almost like a consumer relationship tool, where they can easily manage their relationship with the patient and strip away all that excess stuff that doesn't really matter, doesn't help, doesn't add value. And now they can actually use a tool that helps them help the patient versus the other way around. So we're going to start seeing entirely new software systems being built for direct primary care in this model. We're already seeing there's a few companies out there that are making strides, but still in the DPC movement, we're very early on that too. Not too many physicians when you look at the overall picture. So it's exciting to see.
I wanted to add one thing. So also from just colleagues and physicians in the field, in the practice, is that sometimes they don't have access to the records that patients need. If they're coming from another facility, if they're coming in from another hospital, if they're coming in from a second opinion, faxes may have been sent, CD-ROMs may have been forwarded.
Faxes.
How can they provide care? How can they provide care? And sometimes if you're in the emergency room, you have seconds or minutes to make a crucial decision, and it's crazy that we don't have access after all of the money that was invested. Any patient that's coming through that door is an unknown. So how can the patient, and then the burnout level of the stress of carrying that type of a decision, that's adding to the situation. If we had records, at our fingertips and technology at our fingertips to assist, that's a profound difference in patient safety and as a level of doctors can provide.
It could be something simple as you have a John Doe comes into the emergency room. You don't know who they are. You can't get there might be unresponsive. You can't get the information from them or because you don't know who they are. It could be something simple as a thumbprint, your fingerprint, a facial recognition scan. Instantly, you can access their records on the blockchain. It would just be doctor, just physician with certain credentials that could access this, but problem solved. If you have a shared database, such as what a decentralized ledger is, that's possible, entirely possible. But you just have all these insurance regulations that it's really going to be hard for those to make it happen, to function in that environment. But the technology is there. We just got to utilize it effectively.
So I have a question about this. I'm in a pretty good system here in my town where I can log on right now. I had a 3-part nuclear med test this morning, and it's not completed yet, but I could get online and learn everything that happened today, that I had done. So my question is, how close are we to connecting other systems? I mean, if I'm in my own town and I have stuff done, it's fine. We have access to everything, but I go to Seattle. Well, some places are connected to us in Seattle, but I'm in Texas. How do we connect everyone with the system?
It's going to be a long process. Are you talking about getting say like hospital systems to work back, like interoperability between hospital systems?
Yeah.
Currently there's a good program, FIRE now. They're working with this, and a lot of your bigger EMRs are working with it, and there's a lot of promise there. But in terms of blockchain technology, having a shared global database, that is it's going to take buy-in from hospital. That is just going to be a selling process. You're just going to go to the hospital and say, this is the benefit. And a lot of hospitals, well, they don't want to share their patient data. They want to keep it for themselves and do whatever they want to do with it. So it's gonna take a lot. It's gonna take changing people's minds, the decision makers, just enabling them to do this, for one. Because also you got to look at the security aspect of it. For one, if you tell somebody you're gonna have a shared database with everybody, they're gonna get freaked out. And that's what they do. But look how many people get hacked too.
Yeah.
That's something you got to worry about. But Nabil, I don't know if you want to chime in on this, but we've been working with a company that has an API, or they've been integrating data from multiple hospital systems, and you can access it through one API. And that is going to be in our first app. Not pulling your patient records right off the bat, but it also incorporates health data and tracker data, such as like blood pressure cuff and Fitbits and stuff. That's at the easiest use case, but then you can start pulling in labs, pharmacy records, hospital records. Pretty neat stuff. Nabil, you want to chime in on? You have anything?
Yeah, I was going to mention that when you were talking about selling to hospitals. I mean, that's actually the normal way that things should work. But with this company is called the Human API, and all they do is gather data from your wearables, fitness trackers, but also from labs, 23andMe, all those services where you put all your data, including hospitals. So today you can go to your hospital online and get all your records. They belong to you. So there's no way to prevent people to actually start doing that for themselves and putting their data in this blockchain without going through hospitals. But it's going to take obviously longer to convince people to do that, instead of just going to hospitals and convince them that this is something that's beneficial to have a global shared secure database for everybody.
Well, hospitals are by and large very protective of that data. They think it's theirs. And having been a former hospital CEO, I've never felt that way. The patient or their insurance company is paying me to do whatever I'm doing for them. That's the patient's data. Now, if the patient's willing to share it with us, great. If not, it's the patient's data. And I've never refused a patient medical records unless the fax was out of toner.
Oh, can I jump in? Can we talk a little bit about why hospitals and facilities don't want to give up the data?
Thank you.
Because it's being de-identified and sold for commercial and research potential. And, this is something I'm very interested in. Many patients do not know what actually happens with their data once it's generated. So while we're struggling, and many are struggling on their ends to get data, it is being de-identified and sold and transferred electronically, magically, to all of these different vendors. And patients don't even know that that's happening, and it's happening for profit. And I'd be interested to see, I'm all about research and collaboration. I would be happy to provide my data to advance the field. But, when there's major acquisition at, billion-dollar profit levels,
that's
kind of unfair.
Everything we do today feeds algorithms. Amazon, Google, you name it, it's all algorithms. And that's where a lot of that data goes. And so, when Google, or anyone for that matter, Apple, is tracking you, they know exactly where you've been, how long you've been there, what you did when you were there. Even if you turn your phone into airplane mode or any other ways that you read about to have them quit tracking you, they're still tracking you. And that all feeds those algorithm monsters, as I call them.
And you've got an advertisement next to your face when you get home on your computer. Yeah.
Yeah.
But it would be great if my blood work popped up next to my face when I got home, instead of me trying to figure out how to log in and if it's posted to my portal. There's definitely a better way to do it.
For sure.
That is actually a good idea.
Yeah, it is.
Instead of marketing a service that just, make it easy for your data to just pop up.
Yep.
Yes. Yeah.
Well, you also got to think about too, hospitals and pharmacies, everybody is profiting off us. Facebook, all your social networks, why do you think they offer a service for free? Is because, they're making the money off us. What if you could flip the table and say, all right, this is my data. This is my genomic data. This is my health history. This is every medication I've taken. This is who I am. And sell that to pharmaceutical companies, to researchers. That is one avenue. But at the same time, I don't necessarily want to sell my records to pharmaceutical companies just so they can market more pharmaceuticals to me. I'm under the belief that a lot of what we are prescribed isn't needed, and a lot of our conditions can be solved by proper nutrition and exercise. I was going outside to get some sunlight. I think that as a society, we're just we like the quick, fast approach and a Band-Aid approach. So I don't know, selling all our data to pharmaceutical companies might not be the best thing, but the idea is that it is our data. It is our most valuable asset is our health. And we're sitting on a gold mine that we all have and that we can all control with using a technology such as blockchain. So there's going to be fights in terms of hospitals not wanting to let go of it, EMRs not wanting to let go of it. I don't know if it's going to happen all at once. I do think once Apple starts getting their personal health record or get the contracts in place or whatever that may look like, I think a lot of companies are going to kind of drop their guard and say, okay, well, let's just hop on the bandwagon. Let's give everybody their data. It's kind of my thoughts on that. Eventually it's going to happen.
Well, and I think the potential, once this blockchain in technology is figured out, and in theory, patients own their data, they have now the potential to opt in or out of whatever study or research or commercial purposes, but they could get paid in a cryptocurrency for access to that data. And you can see who's accessed your data. So there's something really exciting to me about that, because there's a transparency that isn't there right now. If I reached out to a cancer center and I asked them, hey, who have you sold my data to, or who's seen it? I don't know if they could actually give me an answer. And that's concerning.
We don't know.
You're probably scared if you did see it, how many people they sold it to. But using the FICO score or the credit score example, you see a history of every single entity that pulled your credit score. So same thing with your health data. You're like, all right, well, this research center pulled it for this. Well, I would like to know, okay, you looked at my data. What'd you do with that? Like the actual research that you did with this huge data set, what was the outcome of that? Because you know what? If you're researching something that deals with my health and something that I have a problem with, I want to help you on that research.
Yeah.
If I know that I'm potentially going to die from something, a condition or disease that I have, I want to do every single thing in my power to give you all my data so you can really narrow down and try to figure out a cure for this.
Yeah.
That's an idea that I think we should start building with Citizen Health, is this collaboration engine is what I'm calling it. And it is where we can open source this whole model and start owning our data and putting our data together and say, okay, we have all these people with all this genetic data, all of our microbiomic data, everything we have. Well, now let's not necessarily just sell it to researchers, but let's do the research on it ourselves. Let's bring researchers in and collaborate with them and say, okay, these are the top 10 conditions that our member base has. Let's try to come up with cures for this. Let's try to come up with better treatments for this. Because right now, some of these diseases that people have might not be profitable to pharmaceutical companies, so they're not going to touch it because it's just not worth it for them. Where, if it's me, if I'm make up, one of 10 people in America that have this disease, I want to be cured. I want a treatment for it. And there's other people that feel the same way. So once you start turning the tables and everybody owns their data, you can start aggregating this data with huge data sets, analyze it, start really just using machine learning with all this stuff and start interpreting what this could mean and kind of just growing a research team out from there. Like we are talking about at scale with millions of people on this. It will create opportunities to cure diseases, to treat diseases, to come up with new methods, new protocols of treatments for particular conditions. So I think right now it's like innovation is not trying to happen because everything is siloed out. You got these pharmaceutical companies don't necessarily want to work with other pharmaceutical companies because of intellectual property laws. Well, that's not benefiting the patient. It's benefiting their bottom line. So I think there needs a change.
So what's the first step?
The first step in what?
In
everything?
Moving this, yeah.
Well, this is what we're doing. Over the next, hopefully in 30 days, we're going to have starting our token sale. Now, I know everybody's been paying attention to probably the ICOs or token sales. Well, in America, the SEC is kind of cracking the whip, cracking down on these things. More than likely, they're going to be deemed securities, which has to fall under federal regulation. So anyways, that's kind of the point, but we are all going to have a token sale. We're going to regulate it, or we're going to do it playing in the SEC sandbox. So in about a month, we're going to have a crowd sale. We're going to try to raise $1 million for this, and it's going to kind of scale us up to our next crowd raise, which is going to be about 50 million, 100 million. We are talking about disrupting healthcare, so it's going to take a lot of money. So once we do that, hopefully within 6 months, we can have a few successful crowd raises, and have a few 100 million to play with. I say that that's a lot of money when you think about it, but we have a lot to do. And then we just open it up for the community. I mean, this is going to be an open source, collaborative effort. There are plenty of people out there that might not have that master's in science or that PhD, but they have a passion for citizen science and wants to go out there in their lab at night or, run some algorithms on a computer to try to solve a problem. And there's plenty of people out there, plenty of stories about stuff like that. So the idea is to start recruiting people, start forming partnerships with research groups, start really organically growing this from people like ourselves that want to see a change and actually make it happen. Like Megan was talking about, there's too many people who just talk. Not too many people will take action. That's what we need to do. There's a lot of groups out there that talk, but if we start putting together partnerships, bringing other people into the fold, start lining out a path, we can make it happen quickly. And that is what we're doing now. So let me give you a kind of brief timeline. Let me see. We have an app that we're calling Humantive. This is going to be probably released a very general beta version, probably within, I don't know, maybe 60 days in the bill, something like that. It's going to be soon. And what that would be, it's going to generate a health score for everybody based off of fitness data, wearable data, user inputted data, such as stuff you can get from Fitbit and Apple Watch. You start off. Eventually, we'll be incorporate 23andMe data, your microbiomic data from your biome, various health records, your sleep, your mood, emotions, things like that. And you will generate a health score. And then based on certain things, that health score can increase or decrease. And we are rewarding these users, us, with cryptocurrency, with Meta. So we're paying people to do healthy things. So we're going to try the behavioral modification part to reward people for healthy activities, which it works. It's proven. Other people are doing it. So that's kind of the first entry point, the first product we're going to roll out there. And also starting here within the next month or so, I want to start reaching out to direct primary care doctors and start forming an alliance, a coalition type thing. And there's a few of them out there that are doing this, but start putting together doctors that understand that this is broken, that insurance is not the answer, and that we need to form some consumer-driven, patient-led, physician-led movement, and really start building out those types of doctors, those relationships, because that's where it's going to be. The doctors that see this happening, the ones that are actually in the trenches right now trying to make it happen, trying to make it work, and start growing that out. And that's probably going to take over the next year, really to get a lot of that over the rest of 2018 going. And then if you start looking at kind of the other progressions of this, we really want to start open sourcing a lot of stuff. So hopefully then when we open source this, when we have cryptocurrencies as incentives to develop on this, we can kind of just open it up to any developer who wants to participate. Then we can start going up our technology stack that we have envisioned. So it's a work in progress, and it's going to take a while. We know this isn't going to happen overnight. It's our health, and it's our healthcare system, a behemoth that we need to turn around. I think Connor, by the way, I think he equated it to a Navy destroyer, and it takes a while to turn that ship. But the first step is taking one. So here we are.
Well, it's just a massive economy. There's so many things that rely upon it. It's not like it's just hospitals, just patients, just physicians, just health insurance companies. It's such a bigger array of things that are affected. So it's just not gonna happen without a fight, and it's not gonna happen overnight. And just the idea is patience with determination. I think it's all great.
Well, Brennan, we're very determined to stand behind and fight with you, but help us get back to the doctor-patient relationship and get everyone else out so that we can talk about how we can be better and how we can have a better quality of life so that we can be better citizens in the world.
That's right. And if you look at that, if we do elevate the quality of life of everybody, and everybody just gets incrementally healthier, just say 1% healthier. I don't have any numbers for this, but I'm just making a prediction. Our whole economy will increase. It's just, you're going to spend less money on healthcare services. You're going to take less time off of work. The employer is going to benefit. Just everything works out better if the population is healthier, and it comes down to individual health too. But yeah, Lisa, that's what we got to get to. We got to get down to the basis. What is the most important? First of all, is keeping somebody healthy. But if you do need services, is getting those services, those procedures done at the most affordable cost possible and by the best physician. So John's got plenty of good ideas about direct primary care. He's working with a lot of physicians across the country. I know, Monica, you just asked, are we focused on any primary care docs in any particular region? I would say everywhere. Well, everywhere in the states that have good regulations for this. 23, 24 states that have good regulation for direct primary care, good bills already that have passed that are favorable to this, that says that this contract does not fall under insurance regulation. So those are the states that we want to target. And John, you might have some more input on that.
Well, there's, I believe, number 25 is about to land in Nebraska. And I think, again, that hasn't kept doctors from doing direct primary care by and of itself, but there's always that specter of the Department of Insurance in each state coming down on them because they're getting pressure from the insurance companies, obviously. But I agree with Brennan. We want to focus, we want to open it up to everybody, but the focus is going to have to be on, and to make sure that the doctors are comfortable with it, that they know they're not going to get landed on by the Department of Insurance. But
True.
Right now there are about, I think, slightly over 800 DPC practices nationwide, which has probably got somewhere around maybe 2,000 doctors, maybe a little less. But there's more than, and again, Brennan said this early on, a lot of people still don't understand or even know what is DPC, what is direct primary care. So that's a challenge in and of itself, but that's why we want to bring these doctors together, bring them on board with us. I can guarantee you that all of them that I know will find Citizen Health and what we're trying to do to be right up their alley. That's what they're doing now. They've taken a big gamble, basically doing away with insurance. They've basically hit their potential income, but at least now they have a life, and they don't have 2 hours of pajama time. They don't have 50% of their day spent, filling out EMRs as, dotting I's and crossing T's for what? So that their employer can make more money and they still get the same paycheck.
Right.
Yeah, it's a time who's come, and I am so terribly excited about this opportunity with Citizen Health, and I can tell you that the DPC docs, even the direct pay docs that I know that are not primary care docs, and there are some of those out there, they are so over the current system that they'll be listening with both ears, no question.
Definitely.
I'm a nurse, and I worked in this system until I became disabled a few years back. And from a nurse perspective, it's horrible. I know, doctors, nurses, anybody who performs tests, everybody at the hospital, this could be awesome for everyone, not just doctors, but everybody else involved with patient care and charting and charting and charting and charting. I mean, sometimes 60% of my day was charting and 40% was patient care. It's crazy.
So I'm a recovering hospital CEO, so.
Yeah, so you're there. It's crazy. It's not what anybody went into practice for at all.
And that's going to be one of our biggest hurdles too, is also getting hospitals on board. They're some of the last people to move. They're entrenched in legacy. Some of them, they're still hooked up to servers, somewhere in that room. And
yes.
If you go to the cloud, you might prevent some breaches. But I mean, this is what we're dealing with. So it's going to take not one, not two. It's going to take, lots of minds to say, to get down to the core messaging and say, this is why you want to work with us. This is why we want to help you. And it's going to take a long time, but, to just keep pounding those messages home that we can help you. So, you be thinking about that too, especially when it comes to accepting Medit or accepting it as payment as well. And I think getting people comfortable with that, comfortable accepting, these forms of payment and getting people to understand them and utilize them is just another form of payment. Lisa had a great point. We were doing some brainstorming. Lisa, I don't want to put you two on the spot, but I know you were talking too about how to basically explain, how Medit works and how, how these payments kind of can even to doctors, to hospitals, or to patients to get them comfortable with you using it. Would you mind explaining a little bit about how you were breaking down the methodology behind it and how the transactions work?
Oh, you mean the cryptocurrency?
Yeah.
Being virtual, unlike the paper money that we're used to holding physically. So you could take a dollar bill, for example, and we've all held dollar bills, and we all know about automatic deposits, excuse me, where you no longer see your check, but and you see the money's in there. And that's what I like about the Medit tokens. They're going to be virtual, and they'll be like your dollar bill, but you can't hold it physically, but you'll know it's in your account. And that's how I would explain it in layman's terms to other patients.
Yeah, I would, more than likely, we never discussed this, but we'll probably develop a credit card, and just something simple that everybody carries around, that you're familiar with this, so it's not like you're just paying with Apple Pay, putting your phone up to NFC terminal, which I do that, and it's awesome to really pay like that. Not too many people do that, and it just dawned on me, Megan, that David Brill, our former attorney, he's with CentraTech, and he's the CEO of CentraTech now, and they develop cryptocurrency credit cards. And I saw where another company is partnering with CentraTech to where they could use their cryptocurrency in any payment. So, I mean, that's an easy avenue right there. We could immediately put Medit on a credit card, and you can use that credit card anywhere Visa or MasterCard is accepted. And all of our money.
Thank you for answering that.
Yeah, our money's digital anyway. Think about it. How often you interact with physical dollars? I mean, it's not too many people really do that. So most stuff is digital. I mean, it's just a 1 or 0. It's a one fat finger away from losing everything in a poor century.
Yes, it is.
So this technology is kind of scary to some people, but if you look at the internet at the very beginning, if you explain the internet to somebody, they're thinking, well, that's dumb. You're gonna hook up nodes that transmit hypertext markup language. It's like, it doesn't make any sense. But fast forward 10, 15 years, like, oh, okay, now I know what that does. So kind of the same concept. Like some of this stuff, it is just, once everybody gets it, it's just going to be everywhere. It can be mainstream, just like the iPhone. Think about it, it was like 10, 11 years ago that the iPhone just came out, and now you can't think of a time when you didn't have an iPhone, really.
Mm-hmm.
And I think that's the idea of, introducing the cryptocurrency like a softer way than, just telling everybody this is how you're going to pay, doctors, etc. And I'm talking about the app that we're building, Brennan. It's a softer way of introducing this whole concept. Basically, the app is not really for payments; it's for getting healthier. But they have all these cryptocurrencies, and people play with it and get it and see the benefits of it. I think it's a good introduction, and a good way of being comfortable with cryptocurrencies.
I agree, and that's one thing I want to talk about too is our health and wellness marketplace, and this is something that we kind of need to start getting going now. Is where people can earn when they earn Medit. Where do you spend the Medit? People have to accept it for anything to actually work. So we really need to start working with vendors that want to accept this currency, maybe not as a full payment, as a 100% payment, but maybe as a 50% payment, kind of like a discount model where, your product or your service is $100, but like Groupon, they'll accept it for $50. So it's kind of the same concept. We can use Medit as a percent off or a dollar or a monetary value off of a product and kind of start getting the economy going like that. There's other companies doing this. Like I mentioned, Groupon, that is a common model. And you have point systems with various apps that do this. But having this cryptocurrency now go to that vendor, now that vendor has an opportunity to spend that cryptocurrency somewhere else. So we are building out an economy right then from having buyers and sellers transact this unit of account, which is Medit. So that's one thing that I want to start working on is, okay, when a doctor gets paid with this, what does that doctor do? Of course, you can sell it on an exchange, cash it out to USD. That might be a little difficult process. I mean, it's not just a one click, but we also might be developing our own exchange later on. Depends on what the SEC does. But at the same time, look at that decentralized health and wellness marketplace and start getting other vendors on board that sell to physicians, the supplies and stuff. So once the suppliers will accept Medit, then the economy starts flowing.
Mm-hmm.
It's another just a great way for patients to have just more access to the things that they need. I mean, even down to, maybe some of their pharmaceuticals that they're currently taking until there's alternatives or alternative therapies or medicines, or, even into healthy food, supplements, vitamins, anything that could, help you with your health endeavors. So it's kind of and then the fact that you could generate the Medit too, and I think patients should be aware of this. There's ways that you could generate it just from even simply walking or, maybe even taking some health risk assessments, whatever, engaging, selling some of your data, but just making people more aware that this is the way to earn it. They could go to help pay for even some more of your health expenses. So instead of, so Citizen Health is also going to help you, down the road, you get to be, maybe you're currently healthy, maybe you're okay, maybe you've got one chronic condition or something, but at least you could start to work towards that. And then, should you have some sort of catastrophic health event, that Medit could come in to help you. So, maybe bankruptcy through for medical and catastrophic expenses will totally be a thing of the past. If we could even eradicate that, what could we do?
That would be wonderful.
Yes, it would.
Imagine?
That would be great.
This would be a thing of the past. So you could keep your house. You wouldn't have to charge up all your credit cards or perhaps file bankruptcy, or your family stays intact, or because it can have ripple effects into your family. So I think that's where we've got to educate patients too. Is what else you're going to do with it. One of the things too, I think for kids, if you put your kid on here, let's think about this into the future. If you gave your kid a tracker or non-invasive tracker, I think of my littlest one, she's 5. If you put that on her and she started to accumulate her steps, even on the playground at preschool, she could be earning Medit for the rest of her life. So the steps that she took even as a child could go to help her with her health or
that's great
sources later.
Big deal.
Isn't that, that blows my mind. That really sells it for me to just be like, wow, this is something that's just beyond what, where people are going. But if we could inject that into the population, wow, just blows my mind.
Proactively bringing this awareness to the next generation, and
Yeah.
the choices that you and the consequences. So that's just not being taught.
Mm-mm.
So it starts to become more like a lifestyle too, and you know, we're changing whole focus. Behavioral modification, as you know, Brennan and I like, you know, the book Nudge is fantastic. That floats around in our healthcare circles. Nudge, I think it's by one of the authors is Richard Thaler, and it's a very interesting concept about how to just give people more choices, and so they can be more proactive or made more aware of what they can do, and I think that's another piece too to citizen health.
Yeah, you got a good point there. You know, what citizen health can do is empower people to make their own healthy decisions. I think a lot of people, they don't know that they can do certain things to become healthier. They think it might just be a lost cause, or they have to take this medication for the rest of their life. And if you just nudges in the right direction, little motivational nudges, it might completely put them on a different course. You don't know till you try. Now, I mean, I know personally some friends that would definitely benefit from this. I always ask them to go do something, go run, but they won't do it. But if you pay them, they'll do it.
Yes, they will. You pay me, I'll do it.
Multiple studies that show that people will do things, go walking, if they get paid to do it every single day.
Incentivized.
To inject this financial motivator to make positive change happen. Hopefully it will stick. And also there are other ways we want to gamify this. I mean, we want to make it fun. And I've been thinking about, we've talked about competitions, like daily competitions, say, go walk 10 flights of stairs today. And that is a community-wide competition. So you might even wager, like, say $10, and you put that in the pot. Well, if you go get those 10 flights of stairs that day and say half the people don't, well, everybody that does succeed gets to split that pot. So it's kind of like a competition. And if you don't succeed, of course, you give up that 10-minute that you put up at stake. So you can have daily competitions and really get people going, kind of communicate with the community, talk back and forth, form meetup groups, and actually get down to the local side of it too. And I wish Clay would have joined us here, but Clay's big on that community, getting back to the people that right across the street. I mean, I don't know about you guys, but I go home and my neighbors, I hardly ever talk to my neighbors. It's just, maybe I'm a bad neighbor. I don't know. But I think too isolated from our community. And I can't even go ask my neighbor to babysit my kid if I got to run somewhere real fast. It used to not be like that. So I think really if we start getting back into maybe not the neighbor side of it, but the community aspect, start joining up for some walks and meetups, go work out, go hiking together, stuff like that. I think a lot of people would benefit from that. So I do know that loneliness is probably the largest, the biggest problem with a lot of people in terms of health going downhill. And so there was one study by Harvard. It's like a 75-year-long study. And it came down to be that the quality of life came out to be the number of relationships, the quality of relationships you had determined the quality of your life. And people that had poor relationships or no relationships, well, they just went downhill quickly. So look out.
And that's a huge factor in the patient community too, and in the chronic illness category.
Yes, the isolation.
Where we're at, and that would be huge for people. Even connecting like this is new-ish, for chronic illness. So to be able to connect on different levels for people would be huge.
Yeah, I have a friend, my wife's friend. I won't tell the whole story, but she got diagnosed with not Crohn's, Cushing's syndrome, Cushing's disease.
Mm-hmm.
Went through a few years of just chaos trying to figure this out. And she wound up diagnosing herself on forums, talking to other patients.
Yeah.
So this, just like you mentioned, this communication with patient groups, well, you might not help yourself initially, but you might have went through something that you can help somebody else with. And there's power.
Definitely.
We are all unique and experts in our own selves, but the world is big. There's a lot of people that's very similar to us, and a lot of people that are about to start enduring the same things that we just came through, and we can help them out. give them tips and tricks on how to do certain things. And that's valuable stuff that you just can't get anywhere else. You can't read it in a book. You can't Google it. I mean, it has to come from just a conversation. So there's a lot of things out there that we're not tapping, a lot of resources that go unvalued that we do want to try to quantify and put into a easy format to share with people. So
and that, my friends, is called advocacy.
That's right. All right, everyone. Well,
share the knowledge.
I need to call it a night. Before we wrap up, now I just want to thank everybody for joining tonight. I guess this will be the first Health Talk. Megan named that, by the way.
Yay!
First minute to come. I like that. Feedback. How does this format work for everybody?
Love it.
It's great. I love being able to chat and see some of you. It's nice.
Yeah, I like this better than just just on the phone. It's a whole lot different when you can see somebody face to face. I mean, Megan and I have been talking about 9 months now, and it's like we're halfway across the country, or all the way across the country just about. And you start forming better relationships with face-to-face communication. I do think that's going to help a lot of patients too.
Well, besides that, tweet chats are a pain in the ass.
Thank you. Thank you. I'm glad somebody else says that.
I'm not sure how this would work if you had, say, 25 people on board.
Yeah.
It might be a little much, but
that's when raising your hand becomes imperative.
Yeah.
Yeah. I think up to 25 it'd work. I think past that would have to be a webinar status where you have one or two people talking, or just a group of people talking, and everybody else just chimes in with messages, questions.
Yeah.
We can look into that. If it comes down to that, that's awesome. Hopefully we get that many people. And I think
nice problem.
Yeah, it is a good problem to have.
So we'll continue this once every 2 weeks, have different topics, and our next topic is with direct primary care, and John will be hosting that. So if anybody wants to join that, feel free. We have it. Megan's probably going to put it on Medium. It is on Medium now, and that's where we'll be making most of our announcements there. And past that, we don't have any future topics, but if anybody has any topics you're passionate about and you want to talk about them, and feel free. This is an open discussion. Anything that revolves around healthcare and fixing it, it's wide open.
It's great.
I'd like to ask one favor. Everybody, please reach out to your congressional representatives. There is a one-page, which is hard to believe, a one-page bill called the Primary Care Enhancement Act that is up for inclusion into the omnibus bill. And what that does, it allows people to use HSAs for direct primary care membership fees. Right now, you can't. Even though the IRS has promulgated those rules, they're so big, the right hand doesn't know what the left hand's doing. I'll post some information and get it out to you all, but just reach out to your congressional reps, both your rep and your senators, and ask for them.
Please do.
Make sure that gets
passed.
Please
post it.
John, could you kindly post something on Slack, and also maybe some sample verbiage on how to have that conversation for people who might not be able to?
It's very simple. A one-page bill is unheard of.
Yes, it is.
So the explanation is very simple as well. I'll put that out on Slack.
That would be great. Thank you.
Also, if I'm pretty sure everybody has joined Slack. If not, please share our Slack channel with everybody. It's on our website. You can join us in Slack. Just share that URL and invite people to the conversation. The more, the merrier. All right, everyone. Well,
great. Thanks, everybody.
Thank you all.
Thank you, guys.
Thank you.
Nice to see you.
Bye-bye.
Thank you. Have a great night, everybody.
You too.
Have a great evening.
Thank you all so much.
All right, bye.
See ya.